Okay, so a couple of key areas. The first key area is the solids collector. So this is where the waste comes to here. So it's important that this is emptied between sessions and taken and disposed of in the hazardous waste area. That then sits back into there. Make sure the cap is firmly on. If the suction pump is actually turned on, this could be quite difficult to lift off, so make sure the suction is switched off. Okay, then it's important to stick to the manufacturer's guidelines for the suction pump, but it's important that every day you take the hoses off, dismantle them from the unit, take apart, autoclave, and clean all difficult areas inside and out, and make sure they're autoclaved and lubricated back, and then make sure they go back in the right way. Try not to be as clumsy as I did it there. Rinse and empty, and then dry off. Make sure they're dried off. The autoclave module should be in pieces. Handleable. And then these areas washed down and cleaned and brushed. That looked really rude what I just did like that. I'm showing the Lithuanians that they're something they're not. Okay. Also the saliva ejector must be dismantled, taken apart, again cleaned inside and out, and actually
take you horrible thing.
Yeah, I don't know.
Okay.
Pop that back in, pop that back in, make sure this is lubricated, so some silicone grease around here. Very important that when they're cleaning these, that they don't use Vaseline. The big temptation for nurses is to use Vaseline because they think it's going to lubricate. What happens is it swells the O-rings up, and the O-rings then get blocked in here. So it's very important that they don't use Vaseline, they use silicone grease. And that's before and after autoclaving. Okay, keeps it well lubed. And then we just plug them back into the system. Clips come back, and that comes off like that.
And then you clean that.
You clean this, but be careful. Some people are tempted to clean the back reflector, but that isn't actually a place that needs to be cleaned. It's just the front lens that needs cleaning. So again, warm, mild, very liquid, mild detergent, warm water. Then once you've cleaned it inside and out, make sure it's totally dry. If you put it back on wet, the heat from the light then attracts dust to it, and dust will go straight to it, and people say, don't you clean your light. So very important, this is dried and cleaned with a lint-free cloth. Okay, and then pop it back on. Like that. Okay. Again, making sure you don't use alcohol wipes in this area, because alcohol wipes, when they get warm, the alcohol dries out and smears. And makes it look horrible.
Okay.
So when the nurse needs to change the water bottle, or the dentist is changing the water bottle, it's important to remember that if this is happening mid-procedure, that the nurse or doctor, when changing the water bottle, with the new refreshed water, doesn't hold the pickup tube and feed in from there. If you hold the pickup tube, you can cross-contaminate the water and whatever's going back in there. So it's important, if you're going to put the bottle on, make sure it feeds in without touching the pickup tube. Okay? And that's a really important one for infection control. And then when you're tightening the bottle, people generally over-tighten these bottles because they know it's compressed air, so they feel they need to crank it tight. With these, you only just need enough to hold the pressure, and you can hear it stop hissing. So here we have the A-decc 2-litre water bottle, which is basically a bayonet fitting. So it's a lift up, a twist, and drops off. With the A-decc 2-litre bottle, there is no external pickup tube. It's an internal pickup tube, so you can't cross-contaminate the water while filling it. So the pickup tube is inside the bottle. Then, when you go back on, put it back on. But before you do that, if you have water, we have a tablet from A-decc that is called the ICX tablet. This tablet is a water line and maintenance product. It is not there to kill biofilm, but it will hold the water at a certain level to maintain asepsis. So when the nurse or the doctor fills the water bottle, they drop the tablet in without touching the tablet with their fingers, just by tearing the sachet. Hopefully it tears a little bit easier than this one. It goes in and then dissolves in the water bottle. It takes 60 seconds to dissolve, then you put the bottle back on, twist it, and it's ready for the next patient.